Hello and welcome to Reiki Cafe's webinar for Wellness Wednesday. I'm really excited to have Bruce Taylor join us today for this exciting conversation. Bruce Taylor is an American teacher gone international. He is a Reiki Master in a Hong Kong traditional Chinese medicine clinic and does retreats all over the world, but currently in France, teaching and hosting retreats in France. And I'm just really excited to have this because, as you guys may know, understanding the emotional causes of our physical ailments is like topic to discuss. And I come from a very Western perspective, chakra-based perspective, but that's still a very Western perspective versus Bruce, who's going to really tell us more about the Chinese medicine Eastern perspective. So I'm really excited to have him join us on today for Wellness Wednesday. And so I'm going to let him kind of fill us in a little bit more on those gaps of an introduction. And then we're just going to have a really great conversation. I'm really excited.
Yeah, well, thank you so much for having me today, Christine. It's fantastic to be here. So my name is Bruce Taylor. I was trained as a high school teacher, so I was teaching economics and sciences like astronomy, philosophy, and these type of things. And that took me to Hong Kong. I taught in Hong Kong for 6 years. I've been teaching in total for 13 years, but I've just left the profession now, and I'm now working full-time at a wellness center, a holistic wellness center in Hong Kong called the Vitality Clinic or the Vitality Center. And it is one thing that's really beautiful about it, it encompasses a lot of different spectrums. So there's a lot of traditional Chinese medicine focus. There are 3 or 4 practitioners within that field, but then there's also osteopaths and some maybe more holistic but Western focused medicinal practices. So that's a really nice balance, and it's really a joy to be able to be working there, especially as their sole Reiki practitioner. So that's what I'm doing. That's what I'm currently into right now, and running retreats with my partner here in France. We do couple therapy retreats, and we'll be doing those in Asia as well. So if the conversation gets into it, maybe I'll get into that a little bit later, but there we are. So I'm super excited to be here. My background as well is traditionally more in like chakras and the kind of the yogic or Western approach to this type of energy discussion. And it's been a really beautiful segue into the Eastern philosophical responses going over to Asia and to Hong Kong. It's really cool to see how they kind of balance with each other, but then all the overlaps as well, which is really quite beautiful to me.
Yay, I'm super excited. So before we really jump into the conversation, I just want to give you a few tidbits on how this platform works. So you guys will notice on your right-hand side that there is a chat box. So you guys want to have a conversation with us, that's where you put your comments. If you have a specific question, there's a ask a question over there. You can hit that button and you can type in your question, and then when I open it up for questions, we'll just knock them out. So that's kind of the platform that you guys can see, and that really helps us stay organized and keep the conversation moving and on track. So comment as much as you can, because we want to make sure that you're getting what you want out of this conversation too, and ask tons of questions. So let's pretend, which I kind of am, complete newbie. Can you tell me just a little bit about the Chinese medicine perspective, what the where maybe the historical component of where they see how emotions and physical ailments come together?
Yeah, of course. Well, first off, I want to say that I want to give an apology if there's any lag on my end. I'm kind of in like the countryside south bit of France. So if there's any lag or if I drop the connection, we'll do our best to get it back. I just want to let everybody know, don't freak out. Don't get off the chat. We'll be back in a second if it should happen. But yeah, from this perspective, traditional Chinese medicine is all looking at the flow of qi. So the movement of energy through the body, which is the same thing that we look at in Reiki, but in Reiki, we're looking to obviously work with our own connection to the universal energy, and we're then giving that, or not giving it, like more as a conduit of that energy to somebody else, and then it's going as its natural intelligence guides it. In traditional Chinese medicine, you're looking at qi stagnation, and the way that same exact qi moves through the body. You can think about this from a Western perspective, like traveling on your central nervous system. It's the same idea. Your nerves are all intertwined and interrelated with different organs. So from a maybe a Western Reiki perspective, like for example, if I'm giving Reiki and somebody comes in and they say they have some digestion issues, or their stomach is hurting them or whatever, then solar plexus, and you start working on that to try to increase the fire and the energy in digestion. Whereas from a Chinese medicine perspective, there might be a yin imbalance or a yang imbalance. Just like within Reiki, when we're giving energy from masculine or feminine side, the right and the left, if you are looking at balance. So I guess in the short way to answer that from a TCM perspective, traditional Chinese medicine perspective, is qi has to flow without any interruption in the body. If it's stagnated in any way whatsoever, then it's going to manifest in specific organs. From a Reiki perspective, a lot of the practitioners and the people listening might think or might be a little bit more familiar with just an energy block and the chakras. Very similar idea. But from TCM, I guess it just goes a little bit deeper in the idea. Like if you have a number of ailments, like if you have nervousness or you have anxiety, you have blah, 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 then a traditional Chinese medicine practitioner is going to look at those, immediately go to the associated organs, find an imbalance, and then try to work that through. Now, they're going to be using things like acupuncture and herbs and dietary changes. And I'll talk about all the importance of that a little bit later on, I think, as the questions and the discussion warrants. But all of that is a way to still work with energy.
Okay, so I hope you guys are taking notes. I am. So I've been told numerous times that I'm too yin. And so you've brought up this yin yang thing. And I'm still like, I don't understand what that means. Can you just give us some, like, I feel like we're building a foundation for the later conversation. So can you tell us a little bit about how Chinese medicine sees this yin and yang? And because I know, you can eat more yin foods, or now there's yin yoga and there's all these things. But what is that? What is the actual foundation?
So you want to look at it. It doesn't need to get super complex. Like we could go quite far into this. Like for example, you might want to eat more yin foods that tonify or and strengthen the liver, but then they might create dampness. And I would be completely out of my league to be able to discuss to that depth, because this is just the stuff I'm hearing here. But from to bring it back to that Western perspective, when we're applying Reiki and when we're giving Reiki, the right side is male dominated and the left side is female. So the way that I look at that is, if I want to have really, how would I put it, really authoritative or like abrupt inflows of energy, then I'm going to use the right hand. If I want to have nurturing, calming, restorative, soothing energy, like clear a block, balance the blockage.
Yeah.
You know what I mean? Yep. So when you're looking at things in traditional Chinese medicine, you want everything to be balanced. If your yang energy is too out of whack, then maybe the fire and some of your burners, like jumping between these, I don't want it to be confusing, but maybe the energy in your sacral chakra, for example, is way too out of whack and there's too much heat. And so that needs to be dialed down by calming, soothing, feminine energy in the same light. So you need to eat things that have that different balance, and you need to keep these things in balance. And again, they all come from, there's different signs and symptoms of having yang deficiency. Like yang, for example, is moving the qi through the body. And if you are yang deficient in your liver, then the blood is going to be flowing a lot more stagnated, right? So the qi is not going to be able to flow around the body in as easy of a manner, I guess I could say.
Okay.
So, from a Reiki perspective, when we're applying Reiki, when you're using both hands, then in theory, you would be providing balanced total energy. Whereas the other way, you're going to be giving unbalanced energy. Does that make sense?
Yeah, I definitely teach a lot about the left, right side component, the masculine versus feminine. And notice where the blocks get stuck. So like throat chakra feels to be stuck and stagnant when there's disagreement with, let's say, a male person in their life. and that they're getting angry or not wanting to have confrontation or communication with this person, and then they'll have right shoulder issues. So do you see that as well?
Yeah, always. I mean, this is if you're looking at a situation where you are having a blockage, sorry, the screen's off there for you, but I'll just keep going. But if you have a situation where you have a blockage and it is coming from a dominant side, for example, if you are female, so your overarching energy should be feminine based, but if you have lots of masculine tendencies, then your masculine energy might be a little bit too disbalanced. You can take that from a Western perspective, and you could look at perhaps there's testosterone imbalances, which then you would be looking at the endocrine system, and then you would be looking at the higher heart or the throat chakra to be working on this. Now, from a TCM perspective, the endocrine system is going to be working with the kidneys.
Okay, and why is that?
So the kidney, because in TCM, the kidneys are, when I'm saying the endocrine system, I'm meaning all the lymph nodes, right, from the neck all the way down as you drain so the lymph system itself is the lymphatic drainage system from the body. So anything that we're trying to get rid of, anything at all, it's going to go from the lymph system, travel down through the body, and then be excreted. Now, think about when, this form of traditional belief was being developed. It's not to say that the belief system wasn't, or the understanding wasn't there, but of course it's quite clear that the kidneys are excretory, right? The urine and everything is leaving the body from the kidneys. So the lymphatic drainage system is going to drain down the body, and the kidneys are going to help relieve anything that is stored. Right now, from a Western Reiki perspective, kidneys are associated with the sacral chakra, governed by water. And so water is the main governing force of apana, which is the release mechanism for the body. So, oftentimes we would feel something like this, like if you have a situation where there is a sudden fright, right? Like you're suddenly like startled really, really, aggressively or whatever. It's going to turn you into fight or flight, and that's going to withdraw your body. So you're actually going to be holding in the solar plexus. Now, from a traditional Chinese medicine perspective, fright is going to be an expression in the gallbladder. But from a Western perspective, with the solar plexus, the solar plexus governs all the organs of digestion, the fire of digestion, including the gallbladder, right? So if all of this energy is coming inward, the gallbladder is stuck, then that's going to lead to stagnation in the liver, and the blood in the circulatory system is going to become a little bit slower. It becomes a little bit more sluggish. So from a TCM perspective, fright is quite interesting. It's one of the main emotions which you can talk about. But fright is very interesting because fright leads to a long-lasting level of fear. Right? Fright is instantaneous, but consistent fright then turns to fear.
See, and I always like when I look at my chakras, I feel like fear is a root chakra issue, and so I see more issues come up about not being able to move forward due to fear. And when I think liver, I think anger. That's where anger is harbored. So this is why I wanted to have this conversation. I think this is actually what triggered this whole conversation.
And that's the thing. It's the interesting thing about that is we're looking at two modalities of healing here, and the overlaps, while there are a lot of really beautiful overlaps, there are things that become a little bit blurred, right? So the liver definitely in Chinese medicine is associated with anger. The reason why, because the liver is moving the qi, it's moving the blood around the body. Now, if you can't move that blood around the body, then it's going to become a lot more difficult for your blood to flow, right? So your blood becomes thicker and your blood pressure goes up, and you have all the classic symptoms of being angry. But in a Western Reiki, line of thought, we would be looking at the liver as an organ of digestion or a blockage within the solar plexus. Now, Christine, what you were saying about being rooted or with fear in the root chakra is very true. The root chakra is all about stability, survival instincts, and these type of things. The way that I would relate that is if you're taking in energy into the solar plexus, that needs to be drained, so it has to be rooted. And if it's not, then it's going to be manifesting and trying to get out. If that makes sense.
So interesting.
Yeah.
Okay, so let's talk lungs. From my perspective, lungs hold the grief and the sadness that can't be expelled. Is it the same in TCM?
Completely. So when you're looking at, think about the symptoms of grief or the symptoms of anxiety. The main expressions of emotions from the lungs are anxiety and grief. Now, think about somebody who is anxious or grieving. They're automatically, at least in my perspective, the first thing that I would think of is hyperventilation, crying, respiratory issues, heart palpitations, this type of stuff. If you're looking at it from a Western, maybe like a traditional perspective on Reiki, then you would say, okay, heart palpitation, stagnation in the heart chakra, the energy needs to be released, heartache, heart pain, these type of things or whatever. From a TCM perspective, and maybe from a little bit of an expanded TCM perspective, maybe more of also like a Ayurvedic perspective, the lungs are taking in prana. So we receive energy from two sources, food and from two earthly sources, not the spiritual Reiki energy, but we're taking in prana from air and from food, right? So all the energy we take in, we're either breathing or we're eating. Now, the circulation of that is either then your digestive system or your respiratory system, right? So it's going to be your lungs and your solar plexus. So immediately you're looking at a stagnation of half of the chi that you're taking in if you're anxious or depressed or, sorry, not depressed, but if there's anxiety or grief or any of these type of things. And then look at how that manifests. If there's anxiety or grief, there's a blockage in the solar plexus in the heart, and that can very easily transmit itself to other chakras. Like if you have a blockage out of grief and sadness, and that might cause you to be more introverted, which then blocks the solar plexus. And by that, you might feel rejection because you're more introverted, and then that's going to block your sexuality and your sacral chakra. And then your animal instincts and survival instincts are then going to be out of whack because all of these other forms of energy, they can't actually ground themselves. So then everything like a domino effect starts out of whack.
Yeah, and how often do we see that? Someone comes in for one specific complaint and you're like, all of your chakras are messed up. It totally is a domino effect. I think we see that very often where, the grief overflows and spills down to all the other chakras. So let's see. We've talked about lungs. We've talked about heart. Talked about kidneys, gallbladder. What about, let's just talk about the digestion issues, because I feel like a lot of people, when they do have that anxiety, it's causing this, but also it causes so much stagnation in the gut. Do you think that's just the overflow symptom and that it really is living in the heart center, or is it, what do you think?
Well, I would say like before, if you have any type of blockage, wherever you're talking, maybe the throat, maybe the heart, maybe the solar plexus, it doesn't matter. Wherever that blockage is, energy is going to consistently try to either flow down or up, right? I mean, we're receiving feminine energy from the earth and masculine energy from the universe. Everything has to be in balance so that you have your aura is, healthy and vibrant and flowing, and everything is being neutralized and restored. So if you have somebody who is, having difficulty grounding, for example, they might have so much universal Reikic energy coming in, but it can't get past their throat because they can't express themselves, for example, right?
Right.
So they have a really difficult time speaking their own voice or being heard by others or actually standing out in a crowd and being their own confident self. And there's going to be some blockage here. So then you find that you have all of this surplus energy circulating around the head. And then look at what happens. You have people who are scatterbrained. You have people who are like always aloof and they can't really figure out where they're going. They've got no direction, no clear thoughts. As soon as that block is opened, then all of a sudden you feel like this waterfall just pours through the body. Now, from traditional Chinese medicine, the perspectives are quite interesting because they're really looking at the organs in the ribs, in the torso. By ribs, I mean like, below the solar plexus, it's just really your intestines. Well, the main ones that we're looking at, liver, spleen, gallbladder, kidneys, heart, and lungs are the traditional TCM organs that we look at. And I would say anybody who's listening and anybody who's maybe just tuned into this, I want to be very clear that I'm not a trained traditional Chinese medicine practitioner. So these are the things that I'm hearing and that I'm getting trained in as I do my Reiki work at the practice, right? So if I misquote anything or whatever, it's not, don't hold me to it. But
absolutely,
yeah.
absolutely.
So, you know, sorry, go ahead.
So let's go through some of those major organs that they focus on. So what about, how about spleen? What do they look like? For me, when I think spleen, I think immune system. It's like the originator spot of the immune system. But how is that different from this TCM perspective? And how do you tap in with your Reiki on spleen? Because once I get over on, like, I'm really good at figuring out regard stomach, but once I move on to the other side, I feel like I'm kind of lost between spleen and pancreas.
Yeah, so just remember, I mean, anything from a general chakra perspective with digestion, as long as you're giving Reiki to the solar plexus or to the general band around the body at the solar plexus, then from a Western perspective, all of those organs are going to be receiving healing energy, right? And
absolutely.
And also remember that if the stomach doesn't need it and the liver does, even if you're on the stomach, it's just going to travel to the liver.
Don't you love Reiki?
I mean, the attention
just goes to where it needs to go.
The energy goes where the attention is needed, you know, and we don't need to channel that. Even if you are channeling, you know, something that's quite grounding is a hand position just on the shoulders if somebody is seated. Just like almost like a waterfall to ground the energy through the body. That is even going to go down and work on the spleen and the stomach and the liver if need be. Now, from a TCM perspective, and this type of stuff I can't really speak on because it still eludes me, but they take the pulse and they feel the intensity of the pulse. They look at the tongue to look at the different organs and the different characteristics on the tongue. One thing that I found to be very interesting from a Western style or like the traditional Reiki that I think we're all practicing in TCM is you can notice some healing crises taking place. Like if you give a lot of Reiki to your solar plexus, for example, then certain areas on your feet might break out. You might get skin peeling and detox symptoms on very, very specific spots of the foot where the chakras are kind of terminating into the earth, if that makes sense. I can go over that actually if everybody would like to know.
Yeah, let's do it.
I won't put my foot up to the webcam because that might be a little bit too personal, but the inseam of the foot, if you can imagine with my thumb, this is the heel. And then imagine the end of my index finger is the end of your big toe, right? So this is the inseam of the foot. So this would be like the inside of my left foot. Then traveling from the heel is the root chakra, and then traveling all the way up to the very tip of the toe is the crown. So the throat would be right at the join of the big toe to the foot. Excuse me. Then you go into the heart, which is a little bit more inside the base of the foot. So it would be like just around here, right at the base of the big toe. And then you go into the solar plexus and to the sacral, which is then forming kind of an arch down to the back end of the heel of the foot. So if you're looking at somebody who is having issues with grounding, for example, and you work on their legs or their hips and you really work to open that up, they might end up getting blisters or their skin might start peeling or they get some sort of redness or discoloration or something on the inseam of their heel. Now, from a TCM perspective, they're going to look at that just as another acupuncture point. So they're going to be working on the specific meridians or the specific channels in the nervous system that are affecting all parts of the body. You might have seen like some palm charts where they are saying, okay, if there's an acupuncture point, if you just press here, then it's going to calm the stomach, for example, and increase digestion. So it's working to send energy through the system.
Now, I've always been curious about the meridians, but it's not, unless you're an acupuncturist in the States, I feel like it's not really, we don't have a map. Like, where's my map? Because I feel like, I can feel the energy, how it moves up your back and then down your front. And I know that, with the EFT tapping, we're hitting our meridian endpoints, right? But I don't feel like there's a lot of general education or knowledge here on where the meridians actually run or where do they start and where do they go next. And I'm assuming that's very much an integral part of TCM.
Completely, and that's where all the training comes in, right? That's years and years and years of study, so that you know each one of the points, each one of the acupressure puncture points, to then be able to apply appropriate levels of acupuncture or appropriate levels of acupressure onto the patient, so that they can not only just either block the flow of energy to one of the organs or stimulate one of the organs. That's the idea. But one of the things, like even if you're just studying traditional yoga, like hatha yoga or vinyasa, whatever, if you're just getting a background in basic yoga, they start talking about Sushumna and Ida and Pingala nadis, which are the main 3 energy meridians running up the body. The way that I try to talk about that is Sushumna is the same thing as your central energy column, or it's the same thing as your spine, however you want to say it. It's the same exact.
Right.
So within Sushumna, you have all of the chakras, the ones that we look at anyway, the 7 main ones. And then with Ida and Pingala, you have the interaction of the male and the female energy on all of the chakras. So I think in an easier, like dumbed down way, and especially without the proper training, Ida, Pingala, and Sushumna is the best way to look at that in a perspective. So like when I have clients and I'm giving them Reiki and they feel no sensations. Oh my gosh, all of a sudden my feet are tingling. Why is my left leg hot? Then I can explain, this is the energy is flowing down your spine or Sushumna or whatever you want to call it. And it's traveling to a blockage in a certain area, and you're having difficulty grounding that. If you can't feel it going out of your feet, then there's a block, perhaps in your root chakra.
Yeah.
Well, from a meridian perspective, I really can't speak on that to any greater length. I mean, because that is like, honestly, probably 4,000 or 5,000 years of scholarly research on that.
Yeah, it's amazing how much information is out there, and I'm just a huge proponent of when you feel emotions and you can't let go of them, they will get stuck somewhere.
Completely, yeah. And from our perspective, like if somebody comes in to me, one of the first things that I ask them is, how old are they? Because you have your chakras opening at 7-year intervals. So I don't know if people are working on that, but the root is up to year 7, and then to 14 is the sacral chakra, and so on. So as you get up to the very top, to the crown, that's your midlife crisis, and then people collapse back down to the root and they can't figure everything out. So that first and foremost gives you a great idea as to where to start. And second off, if somebody's saying like, yeah, I've got this shortness of breath, I don't know what's going on, I have no heart problems, I've got no health issues, my stamina is fine, I'm exercising great and all that type of stuff, but I just can't seem to catch my breath. And so what do we look at? There's obviously a blockage in the heart somewhere. The heart and the lungs are the same chakra, so you're looking at bringing in prana or bringing in air, and we have to figure out what that disbalance is. So I would immediately just start talking about the heart. And then what you find very quickly is there's some trauma, like you're saying, that hasn't been resolved, right? A breakup that you couldn't get over, or some past life trauma that is coming to the surface, or whatever. And it comes out pretty quickly usually,
Yeah, well, and that's why I love doing Reiki, because it really helps dive in and help shift everything to the surface and start moving it so that we can release and bring in the light and help everything line up. And it's just an easy, beautiful healing modality. As you've brought up past lives, I'm wondering what the perspective is from the TCM point of view on that. Like I would say about 1 in 10, 1 in 20 people that come to me, I have past life stuff show up.
I mean, that all depends on the practitioner, and it all depends on the individual beliefs of the practitioner. Some are religious, some are practicing Buddhism or Taoism or anything like that. So they're going to be a lot more open to the idea of reincarnation in this. Some people aren't. And some people are just going to say, there's a blockage in your spleen, that's it. So here's acupuncture. Now, my view on it, I believe in it, and I practice it for myself, but my view on trying to heal these things, like let's go back to the heart, for example. It's quite interesting. If there's any past life trauma in the heart, what I'll often do is have the client just lightly touch the heart chakra, just with the middle finger, just giving a little bit of pressure right onto the middle of the sternum. And the reason I'm doing that is to allow their mind to make a mental connection with the sensation of that pressure in the heart. So they can even just have their hands like this, and then I'll just be applying Reiki over the top. And what I find ends up happening is it's almost like this pressure ends up feeling like they're digging right into their heart. Like they're opening up their chest. because of that small
Yeah.
tactile sensation. Like you were talking about EFT and stuff in the past, or just a couple minutes ago. It's that tactile sensation that's so important. You're linking your mind with the flow of the energy in the block. Whereas the ego
Yeah.
before could say, like, oh, that's just garbage. There's nothing there.
Right.
The tactile sensation allows the ego to be quiet and brings the mental connection to that area. Why is there this block? Why do I feel all this pain? Clearly, pressing with hardly any force whatsoever is not going to create pain. So why is it aching like crazy all of a sudden? Then it just brings it further up to the surface. So in something like that, in TCM, you wouldn't, depending on the practitioner, I've never talked to a practitioner that would go into that level of discussion with you. They would look at your tongue and say, well, it's white and coated, your pulse is slippery, and it looks like you have, yin stagnation in your spleen. So here's a bunch of needles, here's where it goes. Now, and then of course you can talk to into greater detail about it with them usually, but past life stuff, I wouldn't say that I've ever had those conversations.
Interesting. Okay, well, that's good to know. Group, if you have questions for Bruce, feel free. Like the chat box seems pretty quiet over there, and I see that you've got more than a handful of people on. Do you have any specific questions for Bruce from his perspective, from his background, that you want to ask? This is to be a really open conversation.
I'll add, well, and if anybody's thinking up of any questions there, I guess what I'll add to keep the focus there on TCM and emotions and Reiki is the beauty in it is that it's all the same. It ends up all becoming the exact same discussion. It's so amazing to me how many people can come in and they can say, like, I just don't know where I am in my career. Okay, I don't know what's going on. Or, they have this, so they're not grounded. They don't have their financial stability intact. So, okay, if that's not there, then where's the other block? Well, the energy can't get out. So how's your sexuality? It's terrible. Well, of course, because that's all of the stagnated energy is backing up and it can't just flow out. So it's amazing after, 4 or 5 minutes of conversation. And I'm sure everybody listening, if you're a Reiki practitioner, then this probably resonates with you, how all of these things, they just start stacking up.
Absolutely.
Right? It's like, oh, I have a lot of difficulty going in front of an audience and speaking my mind, okay, or putting myself forward. Cool. So how's your digestion? Oh, it's garbage. Awesome. Well, how's your intestines? How is when you go to the toilet? Is that normal? No, it's not. Well, okay, here's why. Okay, so solar plexus, sacral chakra. One thing that I didn't mention before is when you eat, when you're bringing in prana, you have to expel everything as apana. So this is from an Ayurvedic perspective, but everything has to leave the body in a balanced way. It's Yin Yang, right? It's the incoming and expulsion of energy. And so as soon as that's off balance, then you can very easily ask somebody, like, I've got a really super active bladder. Okay, well, then you have an overactive sacral chakra. Too much water, there's too much energy coming in. And these type of things, that's where the overlaps start to get really beautiful.
Yeah. Yeah. So Laura Ann wanted to ask, what do you do from your perspective if someone's undergoing a lot of psychic attack? Like, do you see that a lot in your clinic, since it is coming from a very traditional Chinese medicine where it seems kind of almost has a little Western medicine feel of, like, let's not get too far into the spirituality piece of it. What do you think?
If somebody comes in like Laura, maybe you can give if you don't mind, maybe you can give a little bit more context to that. But if you are, or if this was a question, if I had a client, let's just say somebody was coming in and they were saying that they were having psychic attacks, right? Or they felt they were being invaded. Then what I would be doing is I would be working to empower the crown and the third eye, first and foremost. And so balancing out that energy and giving it protection, and then draining anything else that's not needed to be there. You know what I mean? So the Reiki that I would start with would be just pretty much crown work like this, and then work to draw that any stagnated negative energy out. Remember, there can't be any other space but love, right? There's either love or there's the absence of love. So if you're having anything that's negative is an absence or a void of love, and love is Reiki. It's the same thing. So any type of attacks that's there, you can just constantly feed those two mainly those two chakras. Now, if you're disbalanced from that, then okay, you're feeding the crown and the third eye, but now you have to get stability and strength. So you need to go to the root and you need to go to the solar plexus, right? If you want to balance that out with love, then you might work on the crown and the heart. There are some people, maybe some people listening or whatever, and this is something that I don't fully agree with, but a lot of times Reiki practitioners won't work on the crown. Reiki energy comes through the crown anyways, so saying that is already flowing, so there's no reason to open it up. That's fine. If that's somebody's own perspective. I don't follow that perspective. I still work on the crown as needed. So that's what I would be doing.
Yep. Did that answer your question, Laura, or do you want to tap into that? It seems like one of her questions was like, especially in consideration that the ego becomes the target, along with weakened. I don't know.
Will.
She's got a lot.
I think along with free will.
Weakened free will, and I feel like I get a lot of psychic attack, and it's almost like this part of me is way too open. Like all of my work is way up here. So here's my crown. It's way out here. And I have to literally envision it closing up at nighttime. During the day, I have no psychic attack at all. And it's when I go to bed and I leave it all, my beautiful crown way out here open.
Remember what I was saying, like just giving Reiki here, then you're able to balance and stabilize everything. Now, if you find it to be way too open, just work with feminine energy instead of masculine energy. The crown and the third eye are fully open at night. That's the whole point. That's when you're connected, more fully at these times with these chakras, right? That's why you can make the perhaps inappropriate association. It's not completely inappropriate, but I wouldn't want to run on a tangent with it. But the idea of dreams or seeing things at night or having these type of visual disturbances or whatever, that's an overactive third eye and an overactive crown. There's so much energy coming in, right? Now, the question here was that the ego is being attacked and getting in the way of or creating a weakened free will. Reiki in and of itself is going to attack your ego because your ego is not going to want you to participate in Reiki. That's it's going to stop anything that is going to help liberate yourself is going to immediately bring your ego into play. And that's going to then manifest in wherever one of your weaknesses is. Like if it's really difficult for you to talk about Reiki to other people, or if you want to be a teacher and you can't really teach it, then your ego is blocking your throat, for example. You know what I mean?
Yep. All right, we got a few other questions that came up. One participant here asks, I have a lot of sacral solar problems. My root seems to be the issue. Went through a horrible 22-year marriage. Don't miss sex. None in 6 years now. I don't miss it. How do you unblock what you don't miss?
Is that question on the side here?
It's down in the ask the question box. I'm not sure if you can see it.
I'm really sorry, I can't see that. Is it possible for you to put that in there so I can read it? Can you cut and paste it?
Sure.
I'll answer Rachel's question there, house clearings with Reiki. I mean, I do this all the time. You can, I would imagine if you've been trained in Usui and you're at level 2 at least, then you would know Shokurei can be used to balance, balance energies within rooms. Or, if you have level 2, then you can balance energy throughout time as well. So if you were finding that you were working on a house, for example, and you were trying to like redo or reno your entire kitchen, then you could do Honsaze Shone, and then you could do Shokurei to project that balanced energy into the future on specifically just that one room. It's incredible to remove the feeling of density in particular. I don't know how far you usually get in with discussion on symbols and these type of things. I don't mind talking about those at all. They're so readily available now. I mean, the sacredness is within the practice, so like, so if you feel that the energy is maybe too stagnant in a room, then you can use Shokurei to open, moving, counterclockwise. And if you want to close it, you can move clockwise. So you can just balance things off like this.
And Rachel, so you know, there will be a webinar coming up specifically on this. There's been a huge, I don't know, shift in the energy. I've had more requests in the last 2 weeks to do energy home clearings for ghosts and other things in the last 2 weeks than I have in like 6 months. So that's going to be coming down the pike. So watch out in the Reiki Cafe for that one. I think I might even be doing a little dual webinar with another group. So keep an eye out for that. So
I'll go back.
Heidi.
Sorry.
So I just posted that
question previously about, and then I'll get on to the sacral chakra one, but the question about acupressure on the feet, as long as you're not, I mean, the question was you're not certified in acupressure, but you're having great results. Should you stop? I wouldn't stop. I mean, as long as whatever jurisdiction you're in, it's not against the law, or you're not, advertising your services as an acupressure or pressure practitioner. I mean, why not? When I give Reiki to people, it's almost universally hands-on, and of course, I would be giving some form of acupressure throughout. If it's just a gentle, press down on the shoulder to open one of the chakras, or to open up maybe the higher heart chakra or the throat, just manipulating the body a bit, of course. So, I mean, I would continue on as long as you're having results. Why not?
And yeah, the only thing you have to be careful with is if you're in the States, if they allow you to do acupuncture without a licensed massage therapist, if you need that. So just be careful, because you don't want to get sued for doing something that you're not certified in.
100%.
So that's the only, I have to be careful in Montana, because I have Reiki practitioners working for me who are cranial sacral certified. They're certified, but they're not allowed to do cranial sacral work without a license in massage therapy. So just be careful in that way, because you might get caught in a situation where you no longer can practice in your city or state.
Tracy had a follow-up there. I guess what I would advise is, of course, Reiki is with the hands, right? So as long as you are providing touch therapy, maybe just don't even call it acupressure if you feel like it could get you into some difficulty, and just give Reiki as normal, and just say that there's pressure points that you're working on or whatever. No.
Yeah, absolutely.
Now, this question about the sacral chakra, going through a 22-year marriage, don't miss sex. How do you unblock what you don't miss? That's an integral part of your sacral chakra. If you're not missing it, I'm sorry to be really blunt, but I would say that that's very blocked, and you would need to work specifically on your sacral chakra to open that up. Now, in particular, this was a question from a woman, I'm assuming, or is it a man was asking this? I can't tell. Okay, so from a female here, not only would you be wanting to open the idea of the sacral chakra, but you want to really give Reiki to the femininity of your sacral chakra, to your uterus and to your ovaries, and really work to open up that entire flow of energy yet again, because it needs to be there. Otherwise, the sacral chakra, again, going back to the Ayurvedic perspective, the sacral chakra is the seat of all apana. Everything that comes, all the energy that leaves the body is governed by water. Everything from feces to urine to saliva to mucus, whatever it is, all of that has to leave the body. And obviously, one of the ways that it leaves is through sexuality, and it has to be released. Otherwise, it leads to stagnation and concentrations of energy throughout the rest of the body. And they'll guarantee there'll be disbalances elsewhere.
And one of the things I would add to that is look at the other pieces of sacral chakra. How creative are you? How can you manifest things in your life? Like what inspires you to be creative? Is it art? Is it cooking? Is it dancing? Is it Aikido? It doesn't really matter, as long as you're feeding that space. So the person who's asking the question also had a hysterectomy. So, which only drives further to the point that you had a massive block there, to the point where you needed to have your uterus or a partial hysterectomy taken out, and so it needs some love, it needs some juices, and you might want to consider doing some type of soul retrieval to bring back that energy back into your body.
You can go, Heidi, if you are level 2, then what I would really suggest that you do is send yourself Reiki back prior to the operation. send yourself feminine energy back to your sacral chakra back then, right? So and try to explore when or the, you know, you're saying you were in this marriage for 22 years. So go back every time that block may have been strengthened,
Triggered,
and send energy to it to unblock it. Send energy to, you know, your uterus as if it was still there, and then also give it energy to let it be neutralized by the universe again.
Yeah, absolutely. Yeah. Wonderful. Well, we're at our 45-minute point, and I think we got to all of our pertinent questions. So I'm gonna let Bruce.
There's one more. I don't mean to interrupt. From Laura, and what can you do to bolster your lungs? Just went through a sewer gas thing leaking in your house. Heart chakra work, lots and lots of heart chakra. But instead of giving Reiki just on the center of the heart chakra like this, give it out to the sides of the chest and feel your lungs expanding completely. And then start to really work on breathing slowly. Now, from a Chinese medicine perspective, this is the idea of bringing in qi, right? So the bigger and the easier it is that you can expand your lungs, and the more qi you're able to take in, and then the more of this negativity you're able to release.
And so if you had toxins in your environment too, one, making sure that that's all cleared out. And then if you need some assistance, like a lot of times when I work with people who have an environmental toxin, they're doing a lot of coughing during their Reiki session. They might need some assistance with some herbs like lungwort to help expel anything that's caught and trapped in the lungs from that experience. Yep. So, and it then if it gets into your system, you're also looking at liver detox if it's contaminated your whole body. So those are things to look at. Oh, we moved out. Good. I'm glad you moved out.
The lungs are going to expel, obviously, with the out breath, and then work on the sacral because it's expelling everything else from the intestines or through urine. So your body's going to clean itself out in the end anyways.
Yep. Very good. Yay. Any other questions before we move on? You're so welcome, Laura. So just so you guys know, there's another webinar tonight. You have that button right below here. So click on that. Make sure you're going to jump on with me tonight. We're going to be meeting with Dr. Pollinger. But I want to give some time for Bruce. Thank you so much for joining with us. I want him to tell you all the cool stuff that he's got coming up and how you guys can contact him if you want for more information.
Yeah, so we have just run our first couples retreat here in France, and the focus on this was an integration of Reiki, healing energy, and hypnotherapy. And so it was a really beautiful balance in the sense that what was uncovered through hypnotherapy was then healed through Reiki, and then more was uncovered and more was healed and more was uncovered. And it was a fantastic experience. It was a 4-day experience that we just actually completed at the end of August. So my partner and I did it. I'm a Reiki Master and Reiki practitioner, and she is a hypnotherapist and a sophrologist, and a psychotherapist, she's telling me. And so there's a really beautiful balance through all of these, through these two modalities, and we found it to be really beautiful. So that's something that we are ongoing and we're running. We'll be doing that here in France and then throughout Asia as well. And the other thing that we really are looking forward to is I believe it may be in April or late spring, we're looking to do a variation on a couples retreat where we are looking for couples that are in a good space. There's no serious trauma that they're looking to heal or anything like this, but they want to take their energy to the next level. So we want to use Reiki and hypnotherapy and psychotherapy to open this line of energy and open the connection of the twin flame. And then that is furthered with the dance of tantric energy, right? So all three of these things are working together to further tighten the couple. So very, very
yes,
cool.
Please. I'm signing up.
So if anybody's interested, you can check out my you can friend me on Facebook. You can check out my website, which is just reikiandmeditation.com. And then there'll be more information.
Reiki and meditation. Okay. I'm going to put that in the box, reikiandmeditation.com. Okay. Perfect. All right, you guys. Thank you so much for giving us.
If anybody's.
Yeah. Who wants to go to Hong Kong, right?
Thank
you guys. Yes, yes. So thank you all for joining with us. Thank you for giving up this hour of your day to join in with us to further educate yourself on this look at Chinese medicine, look at emotions, looking at physical disease, and really having this really great conversation. So thank you so much for being here, and I look forward to seeing you on the next one, which is tonight. Check it out.
Thanks, everybody.
Thank you all.
Have a great day. Bye-bye. Thanks, Christine, for the opportunity. I appreciate it.
Absolutely. Take care, everyone.
Bye.